Good evening, everybody. My name is Jake Pannell. I am a national business rep for the National Federation of Federal Employees. We represent a lot of workers, both at VA providers, nurses, mental health, regional office at BBA, and we've been around since 1917, so we're proud to say that we're the oldest federal union. So I'm going to try to stick to my remarks because I get known to cue off just a little bit here. So, we can have a conversation about that afterwards when we're sitting out there. So, I want to recognize that Ranking Member Takano was on that video with us. He has been a steadfast and courageous support for veterans and for employees at the VA when it mattered most, and he continues to do that. And so I appreciate that he had those words for us today. It's really good to be here in Georgia, especially next to what we call Fort Eisenhower. It's going to be Gordon for me the rest of my life as an Army vet. What is it now? Oh, is it back now? Oh, thank God. No, I just don't seem like I don't know what I'm talking about then. Okay, good. So, but I too, myself, I'm a 100% disabled veteran. I used voc rehab to go back to school, and then I went to work for the VA as a substance abuse therapist at the Walla Walla VA. And I did that because I've seen what happens when promise to the veterans is honored and when that promise is broken. And I wanted to be a part of the solution. That being said, here I am now a national business rep because of the fact that I realized that we were not getting the tools as a provider to do my job. I could not do what needed to be done. I kind of love Georgia because Georgia is where I earned my jump wings down there at Fort Benning. And here is the Center of Military Intelligence and Communications. Fort Benning is the crucible that forged some of America's finest warriors. Georgia doesn't just host the military, Georgia shapes warriors here. And Georgia takes care of its veterans, and now we need to make sure that these elected politicians in DC do the same. So a few months back, I remember it was a stormy night. I was driving from the New Jersey VA. I had just left there working with our local there, and I was headed up to Boston, and that's when I was on the phone with the reporter at the Washington Post, and we got that 84,000 letter out there, and we were able to, this was the same reporter that I worked on with a lot of the Cerner project, and so he was willing to get the story out there for us in the middle of the night, and it was great to do. But the wipers were barely keeping up with the rain, and I was thinking, this can't be real. They can't be happening. They are not, we're short-staffed. We cannot lose one person. Yet, there it was, a plan to strip away the very people who hold the VA together. When Secretary Collins went before the veterans and federal employees to defend this, he dismissed the concerns about these cuts as exaggerated. He even used the phrase calling them a Whopper without tomatoes. First of all, I'm a Texas Aggie and I prefer Whataburger. But my words are simpler. It's not a Whopper, it's betrayal. Because when a leader calls those of us who speak the truth liars, that's not leadership. That is turning your back on your fellow veterans. And in the military, we have names for that. I'm not going to say them here. But I've lived on the waiting list. I've been the provider watching veterans' conditions worsen while trying to do more with less. We asked VA staff to dig a foxhole with a spoon. They'll keep digging until their hands bleed, working hours without pay like the nurse like we talked about, skipping lunches because there's not enough nurses to cover the floor. That's not a workplace, that's a battlefield without backup. I saw it personally just 3 months ago when I was traveling for work. I had a medical emergency, and because Cerner, which I came from, which they're using, isn't effectively integrated with CPRS, my records weren't available between facilities. I still waited for meds. I still sit here today waiting for a community consult for cardiology. Cerner wasn't built to serve veterans. It was built for billing, contracts, and to gain money in the private sector. And like they talked about earlier, The billionaires that are making the money, the insurance companies are making the money, and us and our veterans are paying the price. So how much is my life as a veteran worth to you? How much is the life of a medic who saved his unit in Afghanistan worth? How much is the life of a Vietnam veteran who carried Agent Orange in his lungs for 50 years worth? The best investment this nation can make is not in failed tech projects, not in endless committees about committees, it's in people. Federal employees, unionized nurses, doctors, staff, many of veterans themselves, people who know what when the VA does it right, we do it better than anyone else. But I gotta say, this fight is bigger than just the VA. As much as we are here, this is across the federal government. We see the same playbook, eliminating positions not just through open layoffs, but by reorganizations. They quietly strip away the staff and services. They aren't calling them RIFs anymore. They're calling them restructuring, reorganizing. But the effect is the same. Fewer hands doing the work, longer waits, and a weaker public service. It's happening at the VA, it's happening at FAA, it's happening at USDA, where the wildland firefighters protect communities every fire season. It's happening in the Department of Defense, where civilian employees keep our bases running, train our troops, and support the missions around the world. It's happening at the GSA. The lights don't come on without GSA. The supplies don't arrive. The government's infrastructure cannot function. And let me be very clear on this. You cannot replace people at the GSA with artificial intelligence. Technology can assist, but it can never replace the experience, the judgment, and human responsibility that holds the federal government together. We heard a lot of talk about the Mission Act. The Mission Act was created to help veterans avoid those 6 to 9 month wait times. I know, I was a huge advocate of it, and I still am. It is necessary, okay? However, we cannot let the programs that were not designed to do that. They were designed to pick up the slack because they couldn't hire anybody. We cannot let them push my care into the hand of private insurance companies when it can be fixed with just appropriate levels of staffing in the right places. And that place is the front lines and not redundant vision management positions. HR 2550, it's essential to protect this workforce, stabilize staffing, and keep their hands off of those who know veterans best. We will continue to defend America's workforce. We will stand side by side with our VSOs like the DAV, the American Legion, and the VFW to improve care and benefits. Because when unions win, veterans win. This isn't about politics, parties, it's not red or blue, it's about the service of those who sacrificed, those families that have to take care of them. The VA mission doesn't have parties. It doesn't have campaigns, it has a promise. To care for those who shall borne the battle and their widow and their orphan. To protect the VA means protecting the civil servants who carry out the promise. Secretary Collins, he can turn his back on his fellow veterans all he wants, but we, as unionists and veterans, will not turn our back or turn a blind eye so someone else can make a buck. So we're here, there's multiple unions sitting right here together. We're a part of the IUN. The Machinist Union backs federal workers better than anybody else. They've been out there with us every day of the fight. Every union is involved in this. The AFL-CIO, working with our attorneys, helping us with lawsuits, making sure to protect these jobs at all levels, at all costs. Now is the time for more unity and solidarity. Tell them hands off my VA, hands off our veterans, and hands off our workforce.